Hello everyone. We welcome you all to this webinar, Global and Indian Perspectives on Endodontics and Book Launch. Grossmans Endodontic Practice is a classic textbook used by the generations of endodontic practitioners. The latest edition of this much-loved book lives up to the legacy of Dr. Louis I. Grossman, the original author. In this virtual event, we will launch Grossmans Endodontic Practice 14th edition and showcase the highlights. Eminent academicians Dr. James Gutmann will discuss the legacy of Dr. Louis Grossman, and Dr. A. Parameswaran will share his perspective on endodontics in India and the latest edition. The editor of the textbook, Dr. Gopi Krishna, will share the highlights of the book and the video demonstrations. I welcome Dr. Gutmann and Dr. Gopi Krishna as well as Dr. Parameswaran. Before I ask Dr. Gopi Krishna start with the opening remarks, I inform you all that we will be taking all questions at the end of the session and request you to please post all your questions in the Q&A panel on the platform. Now I request Dr. Gopi Krishna to please start with the opening remarks. Dr. Krishna.
Thank you, Ravi. Good evening to one and all. And it's an absolute honor, pleasure, and privilege to be in this platform, wherein I share this platform with two of my teachers, Dr. Parameswaran, who was my postgraduate teacher, and Dr. Gutmann, who has been a mentor throughout my career. So this occasion is very special, a special day in my life. And I'm so happy and glad that all of you are part of this, and especially two of my inspirations are next to me, especially my teacher, Dr. Parameswaran, with whom I'm not virtually, but I'm actually sitting in his house next to him. And I'm so glad that this book launch is happening in his presence with his blessings. As we have just discussed, we would have a three-part in this program. In the first part, I would like to invite Dr. Gutmann to give his perspective on Grossman and a global perspective of his influence on endodontics. So as we go ahead, I would first like to give you a brief of a person who needs no introduction, at least in the field of endodontics, is Professor James L. Gutmann. But for those students who are the fresh students of endodontics, I would just like to give a brief of Sir. Dr. Gutmann is a professor, chair, and postgraduate program director at the Department of Endodontics at Nova Southeastern University at Florida. And he's been an eminent academician for the last 5 decades, and his contribution in endodontics is second to only Grossman, in my opinion. He has published extensively over these, and he's been one of the landmark, iconic speakers, and the person to whom we all look up to for guidance as he takes endodontics to this century. So it's my absolute honor and privilege to have Professor Gutmann in this program. And sir, I would like you to present your perspective on the legacy of Grossman and his influence on global endodontics. So I will now request Ravi to give the share permission for Professor Gutmann.
Do we want to go back on the slides, Gopi? There we go.
Yep.
Okay. Good morning, everyone. And certainly it's a pleasure to be here. Unbelievable pleasure, especially with the distance in miles and how this technology can help us to be able to appreciate and understand exactly the lessons of history. And I certainly want to congratulate Dr. Gopi Krishna and his co-editors and contributors for putting together this marvelous edition. But I want to start you with a story first. Ironically, here I am talking about Louis I. Grossman, and I never met the gentleman. And you might say, wait a minute, you're just about as old as he was. And I said, no. Let me tell you a little story. In November of 1969, now most of you probably weren't born then, I got a letter from Louis I. Grossman inviting me not to be in his graduate endodontic program, but to be the endodontic mentor at the University of Pennsylvania. And this was on a Monday night, I got this letter. And I said, oh my gosh, because once you're a fellow, you get a chance to maybe get into the program the following year. And so I said, this looks like the direction I'll be going in. Well, on Tuesday, in the mail, a letter came to me from the University of Illinois accepting me into the full graduate program. And that's the one I accepted, and I had to turn down Louis I. Grossman. So the fact that I had to turn him down at that time, now is the time to raise him up and talk a little bit about him. Go ahead, Gopi. We can move forward. We have to work a little bit with the slide situation because of having some trouble. He is known as the father of modern endodontics. Go ahead. Just move accordingly. And as you'll see, we have many people who have contributed to the endodontic sector. Keep going, Gopi. But the one that really kind of stands out overall on an endodontic perspective is Louis Grossman. There's no question about that. And that's why I'm kind of highlighting. You can see him in different phases of his life as we move through these slides, how he has changed, how he has evolved, looked upon very dearly by all the students that he had over the years. But he was a tough man. He held everyone to the yardstick, so to speak. They really had to produce. But Louis was a gentleman, a scholar, multiple languages, and towards the end of his life, he still was as strong as ever. You can go one more on that, Gopi, will be in good shape. And you can see how he has aged, but he's still affectionately known over the years as Louis the Root. It's kind of funny when you think about it, but that's how his students refer to him, Louis the Root. Okay, go ahead to the next slide. Like I say, we're working with this thing. You can see he was born in the Ukraine near Odessa. He actually got a DDS in the University of Pennsylvania, 1923. But look at those dates. He was born in 1901, and by 1923, he already had a dental degree. And he went on the faculty in 1926, and then he went off to the University of Rostock in Germany, and he got an honorary doctorate. And then he came back and at the University of Pennsylvania. And as you can see, he started with his textbook. He's contributed greatly. Now we see, and it's actually the 14th edition, my mistake. Keep going, Gopi. Just move along. There's a little bit of a glitch we have here with our slides, but bear with me. And he's had many honors over the years. And I'm just trying to, over the next few minutes, just highlight some of those things and why he was such a unique individual. Go ahead. These are the old days when we used to have those kinds of slides where we had to tell someone to go ahead because we didn't have control of it. So I guess I'm reverting back to my childhood in a way. Like I say, born again in a small village. He immigrated. He went to high school in South Philadelphia. He came from Odessa, which is on the Black Sea, for those of you that aren't familiar with the geography, and came into Philadelphia, into the wilds of the United States. And from there, he developed amazingly because he had mentors at that time that helped him move along also. There he is. He's graduated in 1923 from the Thomas Evans Museum and Dental Institute at the University of Pennsylvania. You can see his name right there. But the person that had probably the biggest impact upon him was Herman Prinz. Herman Prinz was the one that said, Louis, you've got to go to, bring it back if you could, Gopi. You've got to go to Rostock. You've got to get more training. And guess what? When Louis went to Rostock, he had to learn German because everything was done in the German language at that time, and he didn't have a full command of it. He had a command of the Ukrainian Russian type language, but not the German language. So he had to learn that. And this is where he picked up his doctorate in medical dentistry. For those of you that do not know anything about Herman Prinz, I strongly suggest that you pursue anything you can about him because he had an amazing impact on endodontics and dentistry for a number of years. Go ahead, Gopi. That's fine. Another person that impacted greatly upon Louis Grossman was Joseph Appleton, because his expertise was bacteriology. And this allowed then Louis Grossman to do many publications over the next number of years in the area of bacteriology, especially during the focal infection theory. These are just some of the papers that he published during that period of time, looking at microorganisms and trying to determine just exactly what was the cause of the problem, what were the bugs, how can we eliminate them, and this was the major focus during that focal infection theory. Go ahead. You can move away. He introduced us to the PBSC, the PBSN. That's, for those of you that aren't aware of that, PBSC is penicillin, bacitracin, streptomycin, and C stands actually for sodium caprolate. The PBSN was penicillin, bacitracin, streptomycin, and nystatin. He used these in combination and put them in the root canal, and he shows in those slides in the middle the penetration of these materials into the dental tubules. Go ahead. He also showed us the fact that getting that material out of the root canal was very difficult, so we got a lot of false negatives. He gave us the details on how to do actually chair-side staining for bacterial species, how to go ahead and do our culture technique, and he was very, very keen on that whole aspect, culturing. In fact, to the point of having to have 2 negative cultures before you would fill the root canal. The problem is we had all kinds of issues with our sampling, and our ability to actually culture what was truly in the root canal was highly at question at that time. Go ahead. He criticized, oh, come on back. Back one if we can. He criticized the culturing technique that was being done. He also realized that, and this is possibly the most important thing you need to understand, he indicated that practically all the studies that were used in the culturing technique prior to 1936 were invalid, just by the way they were done. And that had a major impact on the focal infection theory and on the American Dental Association, and interestingly enough, on the American Medical Association, to come out with publications indicating that the focal infection really had a lot of invalid principles, and we really need to turn things around and stop extracting teeth because we just don't have the scientific evidence to move forward. Okay, go ahead. His root canal treatment, 1940, his first textbook, which has been translated in 8 languages, and now today we have our 14th edition. As you can see here, which is a real tribute to Gopi Krishna and his co-editors and all the contributors. And I think it's fantastic, and I think the publisher has done a wonderful job in putting this together. I think it's a tremendous book, and it's going to serve as it's kind of the Bible now in many parts of the world. Go ahead. He contributed greatly to the evolution and refinement of endodontics as a specialty in Europe and especially in South America. And as you can see, his honorary memberships in various countries, all the way to Japan, at the Tokyo Dental College, in Brazil. In fact, if you look at Louis Grossman there in that picture, you see him right in the center. On either side of Louis Grossman, on Louis Grossman's right-hand side, I don't know who the woman on the far right is, but on the immediate left is Mercedes Posada. To his immediate left is Augusto Posada, and the other individual is Andy Michanowicz. Now, Augusto and Mercedes were the first 2 postgraduates at the University of Pittsburgh under Andy Michanowicz to achieve their endodontic specialty, and they went back to Bogota, Colombia, and actually had a big influence on the evolution of endodontics in Colombia and in South America, and it's all attributed to Louis Grossman. Go ahead. He founded the Root Canal Study Club in 1939. He wrote about it, the history of the Root Canal Study Club, and discussed it actually in the first Journal of Endodontia. Many of you probably are not aware that there were issues in 1946, 47, 48 of the Journal of Endodontia. And the interesting part about it, the editor of that journal was not an endodontist, because we didn't have endodontists back then. The editor of that is an individual who was very well known in the area of periodontology by the name of Balint Orban. Orban was the first editor of that journal, and he had an amazing impact on endodontics back in the 40s. Go ahead. You can see everybody who had signed that first meeting that they had with the American Endodontic Society, which ultimately ended up, or the American Root Canal Society, which ultimately ended up to be the American Association of Endodontists by 1944, when they had their first meeting in Chicago. We still don't have endodontists yet, because endodontics as a specialty was not approved in the United States until late 63, early 1964. But if you want to read about the formation of that, you can see the reference there in the Journal of the History of Dentistry. Go ahead. He was also an educator. You can see the different positions that he had in various places as far as being associate in oral medicine, assistant professor, professor of oral medicine, emeritus professor. And if you look at that picture on the far right, very interesting picture. This is the first postgraduate endodontic class. Now, when you think about that, remember, we don't have an endodontic specialty yet, but he had a postgraduate program at the University of Pennsylvania. And you can see Louis Grossman sitting in the middle. On Louis Grossman's right is George Stewart, who had a tremendous impact also on the evolution of endodontics. But on Louis Grossman's left, most of you probably will not identify that, but that's Dr. I.B. Bender. And both Dr. I.B. Bender and Samuel Seltzer were actually students of Louis Grossman out of the University of Pennsylvania. Okay, go ahead. Here you can see Dr. Grossman with many of his colleagues. This was let me go back one if we can. Yep. Yeah, go forward. I'm sorry. Yeah, hold it right there. Yeah, you can see there's Dr. Bender on Louis Grossman's right-hand side. He's got the red coat on, if we were to go back to that picture. Remember, this is a great distance to show these slides that are a little bit slow and a little bit fast. Yeah, that's Dr. Bender in the red coat. Next to Dr. Bender is Dr. Harry Bleckman, who was a real leader in microbiology and bacteriology and endodontics for many, many years. And there are many of the students there at that time. That was in 1977, I believe it was, about 30 years later. And so you can see how the class has grown. And for those young people in the audience right now, you can also see the hairstyles, which occurred way back when. We had a lot of hair. I don't have much right now, but had a lot of hair back then, and that's just kind of the culture of the times. But I.B. Bender was just as vibrant and popular at that time, along with Louis Grossman. And the three of them, between Sam Seltzer and I.B. and Louis Grossman, they really set the stage for endodontics in the United States and in the world, for that matter. Go ahead. Grossman's been honored, as you can see. The AAE, American Association of Endodontists, has actually created the Louis I. Grossman Award, and you can see what it's there for. The French Society has also created a Louis I. Grossman Award, which it gives annually. And the Louis I. Grossman Chair was a chair is a endowed chair at the university that whoever takes over as the professor of the department actually occupies that chair, so to speak. And there are many, many supporters of that chair. In fact, one of the main supporters of that chair when it was put up was Dr. Seymour Olliott, who was actually the first dean of the university where I am sitting right now. He was our first dean, and he was one of the first supporters of that Louis I. Grossman chair because Dr. Olliott was from Pennsylvania. Go ahead. Now, here's another person who was very supportive. In fact, this individual was receiving the Louis I. Grossman Award from Louis Grossman, and this is Dr. Nygaard Osby. Many of you will recognize that name. Had a tremendous impact. In fact, for those of you that aren't aware of it, regeneration today, regenerative treatment, regenerative therapy, regenerative endodontics wouldn't be where it is today without the work that Dr. Osby did back in the late 30s and early 40s. He gave us the first inclination of what might happen with blood clots and blood that might flow into the root canal system and the hard tissue that may form. And he was a recipient of the Grossman Award back in the 70s. Okay, go ahead. As we said earlier, he's considered the father of modern endodontics. Irv Nadorf, who I knew extremely well, was a former editor of Endodontics. He said Grossman was the impetus that initiated, formulated, and implemented the multifaceted events that were essential in the recognition and maturation of endodontics. Simply stated, as we know it today, we would not have existed were it not for Louis I. Grossman. Go ahead. Another tribute from George Stewart, who I showed his picture earlier. Some of us were fortunate to have been his students, worked with him as teachers, laboratory, and got the opportunity to know him. To his younger colleagues, he may have been represent the father figure. For some, he was a big brother, helping, guiding, and encouraging us to strive for excellence. That was the nature of Louis Grossman. He was a tough person to get to know, but when you got to know him, he really guided and mentored so many young people in specialty. And really, again, it was the father of modern endodontology. Go ahead. Louis I. Grossman began the World Congresses in 1953. There were actually 5 of them every 5 years, 53, 58, and all the way through to 73. And the purpose of those conferences was to bring about those from around the world who are interested in endodontics. And one is, as he said, one is likely to become intellectually sterile unless there is cross-pollination of concepts, thoughts, and experiences. Now, when you think about that, think about this 14th edition that's coming out now. Grossman's Endodontic Practice, that continuation of the intellectual challenges, that continuation of cross-pollination of concepts, of thoughts, and of experiences. And for you young people, I hope that you will embrace this text, embrace the concepts, and work within those to better yourself as endodontists in the future. Go ahead. Interestingly enough, in 1953, and this is still controversial today, 2 of the most important things that everybody agreed upon was traumatic injury to the surrounding periapical tissue should be avoided at all times. To this end, guess what? Instrument stops should be used and instruments should be confined within the root canal. The second was the canal filling should seal, but should not necessarily be impacting on the healthy apical tissue. Now, we have a lot of controversy today as far as working length and how far we go and pushing things past and the apical puffs and everything we see. Louis set the standard back in 53, but interestingly enough, this standard was actually set back in the 20s. And if you look at so many of the authors that were present in the 20s and the work that they did, they set the standard. Louis was able to bring about more contemporary recognition of the standard, yet today that standard is still being somewhat challenged by many of our clinicians with the perspective of if it looks good on the radiograph, it must be okay. And that somewhat it negates the science and the biology behind what we should be doing. Go ahead. So when you start to look at root apices, we got to think twice about what we're dealing with and where we're going, everything that's involved. Now, Dr. Grossman also had a very valued sense of history. He wrote about history, personal history of dental practice, endodontics, a peep into the past and the future, a brief history. He very, very much brought in those concepts. He did not forget about them. And we all know, we've all heard the phrase, if we fail to pay attention to the lessons of history, we're bound to repeat those mistakes. And he tried to bring that information in and build upon that. And so he wasn't only the father of modern endodontics, but he tried to create a sound basis for all of us for the future, which was really fantastic. And now with this textbook in the 14th edition, which we all congratulate again Dr. Krishna for bringing this about and making it happen with all the contributors. I think this is a fantastic tribute to Louis Grossman. Go ahead. He's also been cited by Dr. Shira, who was the editor-in-chief of the oral surgery, oral medicine textbook. He recognized 6 major men of science and their respective fields that have shared their knowledge and been very influential in evaluating the standards, important role in establishing dentistry is an important part of health, established patterns of excellence. Louis Grossman was one of those people. He was one of those top 6 that Dr. Shira had recognized many years ago. Go ahead. Jake Friedland, who was very, very close to many people as the evolution of the AE, he brought about the issue that many people in the past had condemned root canal therapy as a therapy of vice without virtue. And he said that Grossman had talent, had generosity in communicating and sharing his knowledge. He had a missionary zeal. It was the seeds planted by him in various forms of dentistry that brought forth the fruits that have made endodontics a significant dental therapy. That's quite a tribute. That is quite a tribute to Louis Grossman. And I'd like that tribute to kind of ring in everybody's ears and keep it in your mind because even though it's historical in nature, it really did impact upon what we do today. And we need to think about these things more often and reflect upon these kinds of issues, which brings or creates our practice of endodontics today into a more vibrant scenario. Go ahead, Gopi. Middle name, you probably didn't know, it's Irwin. Louis Irwin Grossman. He has, they have papers, all his papers related to the Root Canal Study Club and the AAE that are in a special collection in the Rare Books Selection at the University of Pennsylvania, and they can actually be accessed by contacting them at this point. And for those of you who might want to go one step farther and take a look at some of those and get access to them and to learn more about this man and the impact that he had, this would be a great way to start. As you can see, Dr. Grossman left us for more fertile endodontic grounds in March of 1988. And again, I started with the fact that I've never met him, but I had a relationship with him. And I'm just sorry I never had a chance to interact with the gentleman. I think I missed out on a very rare moment in life. And so it's really been a pleasure to be able to share this with you in retrospect, because I've learned an awful lot historically by looking at his life and trying to think about that as I move forward. He did give a full measure of his life to endodontics. He's never forgotten. His legacy will live on. And with that, I would like to thank everyone very much for being in attendance and reflecting upon the life of a giant, a true giant, whose legacy will live on. And thanks to Dr. Gopi Krishna for allowing this to occur. So thank you very much, ladies and gentlemen, and have a great day.
Thank you, Jim, for this wonderful presentation. I strongly believe that a passion for a profession can only happen once you have an understanding on the legacy and you have a respect from where you come from. And the history of your profession is so important. And I'm so glad that you could give us the various facets of Grossman and information which most of us never knew, including me. Thank you for bringing Grossman alive today and for keeping him alive in our memories as we move ahead. Thank you for all your input and for your guidance to me personally. Thank you for what you have been doing.
My pleasure.
Now, as we move on, I would now take an opportunity to introduce my teacher, Dr. A. Parameswaran. And Dr. A. Parameswaran has been the former principal of Government Dental College, Chennai, and he also was the professor and head at Meenakshi Dental College and mentored me and many more in this country. He is famously known as the Bhishma of endodontics in India, has been a teacher of teachers, and the growth of endodontics in India to a large extent, in my opinion, from Tamil Nadu has been attributed to Sir. And it's my privilege and the honor to invite Sir here to give his perspective on the growth of endodontics in India. So without much further ado, I will now invite Sir to give his presentation. You are here.
Thank you, Professor Gutmann. I heard you very well, and I was able to see the stalwart of endodontics detailed by you in all perspectives and expansions. Thanks a lot once more. Now let me address our friends and colleagues. First of all, I would like to offer my best wishes for a safe, healthy, and successful 2021. I hope very soon we'll be rid of our masks because we are still holding on. And I'll get an opportunity to address you all in person. I am honored to accept this request from Professor Dr. Gopi Krishna to release the 14th edition of Grossman's textbook of endodontic practice today. Having met Professor James Gutmann just now, he has introduced the original author, Dr. Grossman, detailing on global evolution of endodontics. The enormous effort put forward by Grossman has put a seed in the world for growth of endodontics. Professor Gutmann is also known as very well as a friend of ours in the faculty members of India, and has participated in several academic activities and conferences conducted in India for past few decades. In the year 1988, I was the editor of our association, and I got Professor Gutmann's contribution, a compelling and stimulating article, The Future of Endodontics. Let me thank you once more, Professor Gutmann. Now, they asked me to present my impression of endodontics in India. Let me commence with a favorite quote of mine. I appreciate Sir William Osler. Do no harm. That is the principle with which we endodontists work to conserve the tooth structure at all cost. Operative dentistry and endodontics included treatment of teeth, which are normally affected by dental decay, which cannot be salvaged otherwise. We tried to put fillings and other restorations to regain its original form and function, but when the decay is very severe and it destroys the tooth structure, with the involvement of the pulp, the only treatment of choice was removal of the tooth. Removal of teeth relieved the patient's pain, and they were so elated with the result, but never thought that they will be able to chew much less from that day onwards. The damage done by an initial loss of teeth in the mouth becomes a handicap for a person to consume his normal food, resulting in poor digestive process. Ultimately, it may spoil his health as well. So it is an absolute necessity to save a tooth from being lost due to dental decay, so the tooth becomes functional for several years without discomfort or pain. Earlier days, root canal therapy was considered to be a major procedure involving more time and considering or causing discomfort to the patient often during the process. The specialty of endodontics was treated as a minor branch in teaching operative dentistry. In India, over a time, the specialty of operative dentistry was gaining importance and is rechristened as conservative dentistry and endodontics. The increased awareness made this branch of dentistry more popular, and this allows conserving teeth from being removed. After I qualified in conservative dentistry and endodontics, I made it a point to preserve every tooth, come what may, with the consent and cooperation of the patient. The procedures of root canal treatment were dependent on hand instrumentation in the early days, with the non-standardized reamers and files as a handicap in India. And the sittings were much more for performing the procedure. The battle faced by an endodontist was non-cooperation of the patients, and they were not convinced to undergo the root canal treatment because of the length of time and pain. Every dentist qualified in our specialty of endodontics had a major responsibility to teach, motivate, and cultivate the awareness with the benefits of the procedure of the patients before undertaking the treatment of root canal. Gradually, the equipment and armamentarium were improved over a while to make the procedure less painful and less time consuming. Working with Madras Dental College provided an opportunity to treat increased number of patients daily for restoration and root canal treatment. With the advent of high-speed dentistry and improved root canal instrumentation, we were able to increase the treatment to numerous patients to a great extent. The treatment of endodontics became popular, and the patients were able to understand the benefits of the treatment. This helped us to treat every month 150 to 200 patients for root canal therapy in our institute. Increased awareness and comfort for the patient and the dental surgeon made this specialty accepted by more. Thus, the specialty of endodontics became more sought after branch of dentistry for postgraduate study in dental colleges even today. The knowledge about anatomy and histology and histopathology of teeth have not changed, but the technology of treating those affected teeth by endodontic procedure has developed phenomenally, with the modernization of gadgets and equipment. The dexterity of the hand has increased with a support system from rotary instrumentation, minimal radiographic exposure, and shortcuts in obturation and standardization of instruments and fillers. Recently, microendodontics have become popular to facilitate the operator with more comfort in posture and better magnified vision. Over the 5 decades, I've experienced the phenomenal growth of this branch of dentistry. Today, we treat the patient with a root canal with more comfort, confidence, and with predictable result. As a student of dentistry, I have followed the book of Grossman for over 6 decades. Grossman's textbook on endodontic practice is the most updated popular book of choice in dental colleges for endodontic practice. Grossman published the first book in the year 1940. Over the last 8 decades, many editions were released. The earlier editions of these textbooks were giving importance to the foci of infection from infected periapical tissues and incomplete root canal fillings. Such teeth were considered a potential for extraction to remove the source of infection. Many theories and beliefs have come into practice to improve the procedures of root canal therapy, which were refined over a period of time to achieve a result-oriented treatment. Now coming to the book. The Book of Endodontic Practice discusses the basics of histopathology of pulp, periapical tissues, microbiology of pulp and periapical tissues, diseases of pulp and periapical areas, and the rationale for endodontic treatment. The subsequent chapters detail on factors influencing healing about endodontic treatment. Criteria for selection of endodontic cases was considered a very important step for success of the treatment. The protocol of root canal treatment, armamentarium, used were presented in the following chapters. The introduction of a variety of rotary instrumentation to suit the choice of the practitioner gained importance in endodontic procedures. This allowed the operator to have their choice of rotary instruments in many combinations to achieve predictable results with ease of manipulation in less chairside time. Procedural errors. Prevention and management is a very useful chapter to warn against accidental mistakes committed during the endodontic procedures. Iatrogenic perforation can happen due to the lack of clinical acumen and other factors causing calcification of the pulp chamber. Use of irrigation solutions and selective medicaments enhance the success of the treatment and is highlighted in a separate chapter. Successful endodontic treatment depended on thorough cleaning, shaping of the canal, and finally perfect obturation. After endodontic treatment, the tooth needed post-endodontic procedures as well. Use of lasers for surgery of the periapex and management of perioendal lesions are also discussed, and the interrelationship of perioendal lesions are detailed with sequence of treatment. In 2010, the publishers Wolters and Kluwer invited Professor Dr. B. Suresh Chandra and Dr. V. Gopi Krishna to edit the Grossman's 12th edition in India for the first time. Let me remember my friend and colleague, Dr. Suresh Chandra, a dedicated teacher, a good orator, popular amongst his students, and a prominent practitioner of this specialty. He was always recognized as an active member and office bearer of our associations. Unfortunately, he is no longer amongst us. The current book edited by Dr. Gopi Krishna is the 14th edition of Grossman. He has added 2 new chapters on magnification of endodontic practice and non-surgical retreatment. Microendodontics is now becoming popular among the practitioners and is helpful to make the procedures with better vision. Enhanced clinical visualization of the area of interest, identification of cracks, location of missed canals, management of accidental perforations, retrieval of separated instruments, and to perform microscope-aided surgery and retro preparation are done with a magnified view. Microscopy is becoming a mandatory part of the armamentarium in conservative dentistry and endodontics. The chapter on non-surgical retreatment highlights the principles and procedure of extending methods of conservation of affected teeth. Recommended protocols for treatment of selected cases by use of specialized instruments like glue files, BTR pen and loops are very handy to perform these procedures. Decision-making flowchart for management of fractured endodontic instruments is presented for reference. Of course, retreatment is better attempted preferably with the aid of microscopes. A chapter on the treatment of traumatized tooth highlights the procedure for the conservation and management of a owl's tooth in a flowchart. Treatment guidelines for fractures of teeth and alveolar bone are highlighted in a detailed table extensively with the recent classifications. As a practicing conservative dental surgeon and endodontist, I have seen phenomenal growth in technical aspects, materials, gadgets, equipment, and instrumentation in this specialty. Over the past 5 decades, we have to update regularly with the new information on technology and newly developed instruments to keep ourselves abreast. I am sure this updated revised book of Grossman edited by Dr. Gopi Krishna will be an asset and a ready reference for every dental student and practitioner. Additional information with 10 online videos provided as a guide for various selected procedures of endodontic treatment. Charts given to enhance the approach of various post-endodontic restorative procedures, which are clear and self-explanatory. Several tips are presented in the form of clinical note in each chapter and is unique. These added information are very useful for reference. Let me congratulate Dr. Gopi Krishna on his achievement for bringing an updated benchmark textbook for dental students and practitioners. As a senior-most practicing endodontist, I take this opportunity and pleasure to release the 14th edition of Grossmans Endodontic Practice today. With my best wishes to all my colleagues, thank you once again, Dr. Gopi Krishna, for keeping the legend and missionary of modern endodontics, Dr. Grossman, alive in our midst. Thank you, one and all.
Thank you, sir, for your kind words of wisdom and for your perspectives on the growth of endodontics in India, and as well as your detailed impressions and salient highlights from the textbook or the current edition. As your student, I cannot have a better person to have released this book and to have reviewed this thoroughly for me. It has been my blessing to have you as my teacher, and I thank you for releasing this book and this edition of Grossman's 14th edition in the presence of Dr. James Gutmann. Thank you once again, sir. Now we would proceed, and I would go ahead to the last part of the program, which would be to give you just as an editor of this edition, I would like to present to you my impressions on this textbook and as well as some of the highlights of this textbook. Is my screen visible, Jim? Can you see the screen? Are we good to go, Ravi?
No, it's not visible, sir. It came and then it went off. You need to I do it again.
I'm going to share again.
Yeah.
Yep. Is it okay?
Yeah, please go ahead.
Yep. Thank you, and it's been an absolute privilege and honor in my life to make this presentation on the continuation and the highlights of Grossman's legacy for the last 80 years, from 1940 to 2020. This slide is thanks to Dr. James Gutmann and his efforts to bring to me all the first page covers of all the previous editions from 1940 till the one, including the Spanish translation in 1959. So as you could see, Dr. Grossman had been publishing edition every 4 to 5 years from the time he published first in 1940 till the 8th edition in 1974, and the 9th in 78, and the 10th later. And the edition which most of us of my generation who had gone through was the edition what you see here in 1984, the blue hardcover book. I think every dental student in Asia and most parts of the world who are currently practicing endodontics would have gone through this 11th edition, which was edited by Grossman, Ollier, and Carlos Del Rio. So this was the book which we had done, and after his demise in 1988, the Grossmans Endodontic Practice was not republished due to some issues with the publishers. But after a long hiatus, it was in 2010 when, in fact it was 2007 when Wolters Kluwer invited Dr. B. Suresh Chandra sir from India to revive this legacy of Grossman. And Dr. Suresh Chandra, in his wisdom, and thanks to Dr. Parameswaran sir here, he chose me to be his co-editor, and we both worked for more than 2 years for us to bring out the 12th edition in 2010. And I owe this position of being a co-editor or editor of Grossman's Endodontic Practice to my mentor and teacher, Dr. B. Suresh Chandra. We collaborated again after a few years, and we brought out the 13th edition in 2014. But just after a few months after the edition came out, Dr. B. Suresh Chandra passed away, and it was a huge loss to both endodontics and as well as to me personally. And over the last few years, after 2014, we saw that a lot of advancements, and then the publishers asked me to bring out the new edition, and here we are in 2021. We are bringing out the 14th edition of Grossman's Endodontic Practice. And this would be available both online as well as on all the traditional portals of buying. As Dr. Gutmann told in his lecture, that one of the attributes of Grossman was to make sure that there is international collaboration wherein we can have thoughts and concepts from all over the world. So although this textbook of the current edition, I have written all the chapters personally, but I made it a point that I bring in collaborators from all across the world. We had 70 contributors of cases, images, and concepts for this book. And they come from all over the world, and I would like to acknowledge each one of them in this inaugural function, right from Australia, Jeff Young and Peter Parachos, Brazil, Alessandro Carvalho, Carlos Estrella, Carlos Soares, Pecora, Manuel Sosa Neto, and Marco Vesiani, a good friend of mine who gave us the micro-CT image of this cover page of this book. As you could see, it's a brilliant image of a micro-CT, and this is courtesy of Marco Vesiani. From Canada, Anil Kishan, he gave some of his inputs, and Anil is a personal friend and a good mentor for many of us in India. Bing Fan from China, Julian Weber from England, Ahmad Ibrahim Salim from Egypt, and Willy Petro from France. They all contributed their cases. So did some beautiful regenerative endodontic cases from Anthony Shaniotis from Greece. From Germany, we had Domongos Howard and Sebastian Howard, along with Tilde Maschke from Germany, who were contributors of their cases. And we had a wonderful set of my colleagues, including Dr. Pradeep Kumar, my student, Aparajiten Ahindita, my professor and head at the institution where I'm currently, Dr. Aarti Ganesh from Sri Ramachandra Institute at Chennai, Arvind Shenoy, Dr. B. Shivapada Sundaram, Praveen Kumar, Nyanavi, Hannah, Harsh Vyas, Hemalata, Manjuna, Kritika Datta, and Mahimat Lakchan, Nandini, Priya Ramani, Priyanka Ashok, Ravi Shankar, Ruben Joseph, Rohit Kathavkar, and Karthika Kannan, all of these wonderful collaborators and clinicians who gave me many of their cases in this book. Some of my friends include Sanjay Miglani, Siju Jacob, Sarumati, Tarek, and Vivek Hegde. From Iran, we have Saeed Asghari. From Israel, Steve Metzger. From Italy, Dr. Arnaldo Castellucci, some amazing cases on surgical endodontics. Filippo Cardinali contributed some of his work for the isolation chapter, Gianluca Lupino, and from Jamaica, Sachin Alapetti, gave some of his, contributed his wonderful clinical work. Netherlands, we had Nick Obdam. From New Zealand, Venkat Kanakapalli. From Romania, Sergio Nicola's amazing work on retreatment, and micro-CT work from Frank Paquet from Switzerland, and amazing histology work from PNR Nair from Switzerland. And from Norway, we had histology chapter, a lot of images on embryology and histology was contributed from Matthias Nordby and Randy F. Clinch. And from Thailand, we had Girafat Jantarat, and from the United States of America, we had Bekir, who comes from the same University of Penn, where Grossman is, Cliff Ruddle, a wonderful mentor again, with some of his amazing cases, Dean Baugh, Brady, and of course, my mentor and godfather, Dr. James Gutmann, who has been instrumental in guiding me and mentoring me throughout my career after my post-graduation. And his inputs and his guidance are priceless. Thank you, Jim, for being there always. Jason Hales and Louis Berman, including Martin Spiller, Neetu Kohli, Samuel Krachman, and Professor Singyu Kim. And from Ukraine, we had Vladimir Kovtun. So we have a total of close to 70 contributors from these countries who could bring in their work for me to write this edition of Grossman's 14th edition. And some of the highlights was when I was working on this book was to simplify complex disease dynamics with the form of flowcharts, so that it makes the understanding of the disease process as well as the treatment dynamics makes it much more easy, including trying to formulate treatment protocols in a way that makes it easier for students to understand this. We have more than 1,200 plus high definition images in this edition of Grossman from all these contributors across the world. So what you would see is not only an updated concepts of endodontics, but also cases to show you how these treatment protocols work. So you would see follow-up cases from some of the best clinicians that I personally know across the world, and their work is showcased in this textbook, along with the treatment outcomes of the various options which are available. I made it a point that we update the classifications and terminologies, and as you would be aware, the International Association of Dental Traumatology updated their trauma guidelines in 2020, and so this textbook would be one of the most updated textbooks when it comes to most of the concepts, classifications, and terminologies that would be present in the field of endodontology. The other aspect I worked on was try to again create tables to compare the various disease aspects and clinical markers to differentiate diseases. So this is a classic table which we created, trying to see how we can compare the disease processes and to see how the history, the diagnostic and the radiographic and clinical findings can be different between diseases which can present with similar symptoms. There are two new chapters which I brought into this edition. One was obviously on magnification in endodontics and the role of both loupes and microscopes in endodontics, with a lot of my personal documentation images under the microscope being showcased in this edition. We also have a lot of clinical tips for challenging scenarios like this, wherein it's a classic the tips on isolation from Filippo Cardinali, my good friend, and many other areas where we could showcase how this textbook would not only be useful in terms for a student perspective, but also for the practice of clinical endodontics. We also have taken care to make sure that the histological aspect, the true science of histological aspect, is better understood by having a lot of slides on this. And we also updated all the current newer terminologies and line diagrams to make sure that a student of endodontics is able to understand the nuances of the various concepts and treatment plans. So this, in a nutshell, is what Grossman's 14th edition, the genesis has been over the last 2 to 3 years, and this is the final output, which we are proud to launch today in terms of both online as well as sales across Asia and the world. And at the end of this webinar, there would be information shared with you, which we can procure this textbook as they want. So online and bookstore sales commence as from December 2020. We have given some online resources in forms of clinical videos. So I'm just sharing one of the videos in this presentation and trying to see what are the various modes of instrument retrieval. And personally, as a clinician, one of the areas of challenge is on instrument retrieval. And here I showcase a small case report wherein the traditional format of trying to remove instrument like this from a distal root of upper maxillary second molar is used with the help of ultrasonic tips. And when we use these kind of ultrasonic tips, although they are effective, whether in the form of ultrasonic tips or in the form of U-files, but the problem happens is when you are troughing to create the channel, we might lose precious dentin around the instrument. So what it does is by the time we do this procedure, we might end up, although getting the instrument out, but as you see in this case, I have removed the instrument, but at the expense of a lot of loss of dentin around the root canal space. So I'm trying to showcase a small video, which is of a technique which we can use to remove instruments, which is the loop technique. And here's a small video by which we can showcase how we can do this technique. So here's a small case report, the lower mandibular molar with a separated instrument in the apical third across the after the curvature of the canal. This is a radiograph after crown disassembly of the same tooth. And here I'm employing, in this case, I use a BTR pen. It is although there are various techniques to use the loop, but this is a commercially available loop, which you can formulate to engage and lasso the instrument and pull it out. So here's a small video demo, and we have such videos as resources in the textbook online, so people can see various clinical procedures in the textbook. So this video, I show you that we use a microtrephining burr to create a channel inside the canal initially. And after the trephining is done, we are using a ultrasonic tip to do the dentin disengagement around the canal. And once we do this, this is basically to create a space for us to reach to the coronal end of the root canal, or where the instrument has been separated. And once that has been done, we are using the loop technique, wherein we insert the loop through the channel which has been created and try to engage the loop around the coronal third of the separated instrument. And once we go 1 or 2 millimeters across the coronal end of the separated instrument, we can tighten the loop, and then we use the loop to, we close the loop, and then we try to pull the instrument out of the root canal. And you would say that this would be done right now. And you would see that after the loop is closed, that you are able to remove the separated instrument, but obviously under magnification. So the only care which is to be needed is to make sure that we have sufficient amount of the instrument engaged around the loop, otherwise the loop would slip out. So that is one of the beginner's mistake. But after that, this is a predictable way of removing the separated instrument. And so this is a technique wherein we remove the instrument, and I would show you the X-ray, pre-op, and the post-op. So the advantage in this technique is the amount of dentin which is lost is much lesser than in most other techniques, and this is a technique which is more useful when we are doing it in beyond the curvature of the root canal. So these are the images of the instrument which is retrieved, and this is the pre-op and post-op of this case. So these are the kind of clinical work which we apply to showcase in the textbook, and which will also be available as clinical online resources for the textbook. And at this point, I would also take this opportunity to also let one and all who are listening to this webinar to know about the plans for us to go ahead with the Asia World Endodontic Congress, wherein due to COVID last year we could conduct it only as an online congress between September 23 and 26, but the on-site IFIA Congress will be held at Chennai during August 12 to 14, 2021. So Jim, you can pack your bags and be ready to board the flight once your vaccine second dose is done. And we really look forward for all the practitioners, students of endodontics to be part of the Global World Endodontic Congress that will be held later this year at Chennai in August 12 to 14. Obviously, this would have, as again, a legacy of Grossman. We would have speakers representing almost every continent in the world, and it would be a true amalgamation of concepts, thoughts, and clinical exchange of ideas, and the World Congress would be an ideal platform for that. And with that, I would like to thank one and all for being part of this, especially team of Wolters Kluwer, as well as my teachers, my family and friends, and of course, each one of you who are part of this webinar and this program to be part of this a momentous day in my life, at least for launching the 14th edition of Grossmans Endodontic Practice. Thank you one and all, and then now we would have the session open for any questions if they are there. Thank you.
Thanks, Dr. Krishna. So as I could see, there are many other people, are, although that, they are not many questions, but there are many, comments in terms of congratulating you, being and Dr. Gutmann, Dr. Parameswaran to be part of the session. They were very much excited to see the history of Grossman here, and a lot of commendable, I can see the remarks over here. Thank you so much. And so far, we don't have any questions because, when you are talking about the legend, so what all questions that you can ask? So I can see, so that all are congratulating you for sure, and congratulations from our side also, sir. And thank you so much, Dr. Gopi Krishna, Dr. Gutmann, Dr. Parameswaran to be part of this, and thank you very much for having this launch session for Grossman, because Grossman itself is a very big title for Wolters Kluwer also. And again, my thanks to all the viewers also who are right now a part of this session. And from Wolters Kluwer, we always always be coming up with such more webinars, informative webinars from the leading authors and the leading titles that we have in our in our kitty. And thank you so much. So right now, I think we should rest our session now. And thank you very much again for everybody here.
Yeah, thank you, Ravi, for conducting this, and thank you on behalf of this. Thank you, Jim, for your perseverance. Thank you once again.
So, Dr. Krishna, just one question. There was I just see one question is just now arrived. There was a gentleman who's asking for your opinion on biomimetic dentistry. Biomimetic. If I DIO, it's like biomimetic. You can see the chat column there. On the chat column.
I think we would need a separate webinar on the same. So I would
okay.
So I would rest the case there. But I would say that endodontics is the field where we are talking now, and endodontics would play a huge and integral role in dentistry as we move ahead. And with the advent of regenerative endodontics too, I think endodontics has a huge role to play in helping dentistry grow globally. Thank you.
Thank you so much, sir. Thank you so much.
Thank you.